Thank you for joining us for this interactive Facebook Live event presented by Siteman Cancer Center based at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. Siteman is an international leader in cancer treatment, research, prevention, and education. Ranked among the top cancer centers by U.S. News and World Report, Siteman also is one of only a few U.S. cancer centers to receive the highest rating of exceptional from the National Cancer Institute. Welcome to today's Facebook Live.
Thank you for joining us today for our discussion of head and neck cancer and treatments. Joining us are two Washington University surgeons who specialize in head and neck cancer. To my immediate right, we have Dr. Jose Zevallos, an associate professor of otolaryngology and chief of the division of neck surgical oncology. And also with us is Dr. Jason Rich, an assistant professor of otolaryngology. Thank you both, gentlemen, for being here and sharing your expertise with our viewers today.
Thank you for having us.
Thank you.
Yeah.
I want to remind our viewers that this is a live event, and so your questions that you add to the bottom in the comment section, we'll answer as the event continues. So please do submit those questions. Dr. Zevallos, we're going to start with you. Now, when we say head and neck cancers, we want to be clear that we're not talking about brain tumors, right? This is a different kind of cancer.
That's right. And head and neck cancer encompasses a wide umbrella of different cancers. And we like to think about it from basically the collarbone up all the way up to the skull base, up to the area where the brain and the rest of the face meet. And we're talking about cancers arising from the mouth, from the oral cavity, the tongue, the throat, the voice box, the thyroid, and then some advanced skin cancers. And I think when we really think about head and neck cancer, however, the majority of what we're thinking about is cancers arising from the mouth and the throat.
Okay.
And there's most of the cancers in that area have a similarity in terms of the type of pathology that we see and in treatment.
Very good. And how common are these head and neck cancers?
So if you look at head and neck cancer, there's been a lot of changes over the last 20 years in terms of how cancers have changed, and some of them are becoming more common in the head and neck. If we look at head and neck cancer overall, so talking about cancers, like I said, of the lining of the mouth and the throat and the voice box, where it's the sixth most common cancer in the United States. Worldwide, it's even more common sometimes. We're talking around 70,000 cases in the U.S. per year.
Okay.
Some different sites within the head and neck, so example being the throat, the tonsils, and the base of tongue. There's been a rapid rise over the last 20 years that I think we'll talk about later, but probably about 70,000 cases per year. I will point out that the mortality, so the rates of survival for these cancers are lower than many other cancers. So even though it's not the most common cancer out there, it's a cancer that obviously deserves a lot of attention.
Very good. Well, that's certainly encouraging news. Now, Dr. Rich, can you tell us some of the causes of cancer? I know different types of cancer often have different causes. What are the primary ones for head and neck cancer?
Sure. As Dr. Zevallos said, there's a wide range of different cancers, and so there's a wide range of different causes for these cancers. For advanced skin cancers, that's oftentimes extensive sun exposure or patients that are immunosuppressed after a transplant or if they have leukemia. That's on the less frequent side. The majority of the cancers that we take care of are more of the what we call mucosal cancers in the throat. And historically, the leading cause of throat cancer, mouth cancer, voice box cancer has been tobacco and alcohol abuse. However, as we'll be talking about a little bit later, a rise in HPV or human papillomavirus related cancers causes a lot of the tonsil and base of tongue cancers, and so that's the greatest cause right now of throat cancer is this virus.
Okay, and I think this would be a great time to go into a little bit more detail about what HPV-related cancers are.
Go ahead.
Sure. So, HPV, as Dr. Rich mentioned, is a virus. It's a DNA virus, and it's the same virus that causes cervical cancer and also some other cancers that are associated with women, primarily gynecologic type cancers. However, we now know, and this knowledge kind of developed over the last 20 years, so fairly recently, that HPV, the same exact virus, also causes throat cancer.
Okay.
And what happened was that we started seeing patients who are not smokers, but were getting the cancers that we typically associate with smoking. And oftentimes these patients never smoked or smoked very infrequently. And we found that this virus, in the same type of way that it causes cancers of the cervix, it also causes cancers of the throat. We know also this virus is a sexually transmitted virus, but it's important to point out that many, many people in the US and globally are exposed to HPV. The fact that a small fraction of those patients who get exposure get cancer, we're not really clear on why yet. We know it's more common in men than females, males more commonly in males than females, but we're unclear as to why, given that so many people are exposed, why a small fraction of those people get these tumors.
Okay, so that's work that's yet to be done, but I understand there has been extensive work in creating and developing a vaccine to help prevent cancer related to HPV.
Right. So from our perspective, even though we treat cancer, we would much rather see prevention than having to treat cancer. Despite how good our treatments can get, we always want to prevent. And in head and neck cancer, specifically in HPV head and neck cancer, it's one of the few times that we have an opportunity for real prevention. And we call this primary prevention, which means that we can actually prevent cancer arising altogether in the throat. The HPV vaccine, has evolved over the last 20 years. And it was originally just 4 strains of HPV that were covered. And it was designed primarily to prevent cervical cancer. And it's done a really great job at preventing those cancers. We've seen over the last 20 years the incidence or the number of cases of HPV cervical cancer drop in the United States and around the world.
So it's indisputable that this vaccine works.
Absolutely indisputable. And now that as we talk about the newer vaccines and we also expand the people who should be getting it, namely giving it to males, giving it to boys and to males, we expect a significant decline in HPV-positive throat cancer.
Okay. My son's 10 years old. When should I be taking him in for the vaccine?
So I would say now or very soon. The indications, the ages that we recommend vaccination are changing a little bit, but we know that males and females in early adolescence through the early 20s, that group should get the vaccination. Recently, in the last 2 weeks or 3 weeks, there's been an increase in the age group that should be getting vaccinated. And now the recommendation is up to age 45 for both males and females. And we know that that can help us prevent even more HPV-positive cancers.
Very good. So, again, we were talking earlier before the show about what exactly that means. So, beyond 45, despite whatever your history may be, what is the exact benefit of being immunized at that age?
It's a good question. So, the vaccine covers 9 different types of HPV strains. There are actually over 100 different HPV strains. And even if most people who are sexually active have been exposed to the HPV, they haven't necessarily been exposed to the strains that cause cancer.
Okay.
So even if you've been exposed, there's still a potential benefit to vaccination.
Very good. Now, Dr. Rich, we just received a question from one of our viewers, and she asked, could HPV cause thyroid cancer?
No, HPV is not associated with thyroid cancer.
Okay, well that's good to know. We do have another question here. Are there any exciting developments in head and neck cancer research? I know you guys are researchers. What are you working on specifically? And then maybe, from a larger view, what kind of work is happening?
So I can take a little bit of that. At Siteman, I think one of the benefits of being at a place like Siteman and Washington University and Barnes is that there's really cutting-edge research across the board. And I think in head and neck cancer specifically, we've made some real advances. Globally, one of the newest things out there for head and neck cancer is immunotherapy. And our institution had one of the very first trials of immunotherapy for head and neck cancer. That trial is now in its second iteration. We're enrolling patients now. And immunotherapy, using the immune system to basically fight the cancer, so strengthening our immune systems to fight cancer, is shown to benefit all kinds of cancers, including head and neck. My specific work, I work in what's called translational head and neck cancer research, where we basically try to find things in the lab that are more quickly translatable to patient care. For example, we find new genomic markers using genetic analysis of tumors to try to figure out which tumors deserve which treatments. What we hope to do is personalized therapy and to make that the future of how we treat head and neck cancer.
So two different people with the same type of cancer might get different treatments based on their genetics?
That's where we're headed. You know, I can't say we're there now, although there are trials that are already there.
Okay.
And I think there's a lot of areas for us to improve how we use the foundation of the tumor to define what therapies we use.
Okay.
And another important trial is the MINT trial that we're doing now, which is a trial for HPV positive cancer that I think is probably worth mentioning too. You know?
Yeah, since there's such high cure rates with HPV-related cancer as compared to smoking and tobacco-related cancers, a lot of the emphasis throughout the nation, but especially here at Siteman, is can we de-escalate or bring down the extent of treatment to still get excellent cure rates but minimize the complications or toxicities with treatment. And so we've been on the cutting edge of doing these trials for many years now, and we're just enrolling a very novel trial that we're very excited about that should roll out in the next few weeks to months.
That's very exciting. I suppose if anyone were interested in finding out if they qualified for any of these trials, how would they find out?
Well, I think the best way would be to, if there's any concern that you may have a head and neck cancer, or if you're diagnosed, to please give us a call. There'll be information at the end of this program, and we will get you in for an appointment, a consultation with one of our head and neck surgeons, and we'll be able to assess and discuss treatment options and clinical trial options.
Very good. Now, you mentioned research kind of being at the core of what Siteman and Washington University have to offer. Another aspect of the care here, as you know, is the multidisciplinary aspect, and that obviously means, you know, you're surgeons, but there are specialists who kind of attack cancer from different other ways. And can you talk about how you talk to them, how you come up with a treatment plan that's right for the particular patient?
So I think as surgeons, we are 1/3, or of the treatment team for head and neck cancer.
Okay.
What makes us unique and what makes good cancer centers unique is that we offer true multidisciplinary care. And that includes, in most cases, surgeon, a radiation oncologist, and a medical oncologist. These are aggressive cancers in many cases, and there's nuance to therapy that requires a team approach. And we actually have been on the cutting edge nationally, but also here at Siteman, in providing a true multidisciplinary clinic. So we have a clinic every Wednesday morning where new head and neck cancer patients can see all three team members, a surgeon, a radiation oncologist, and a medical oncologist at the same time.
That's
and in real time, we discuss the treatment plans. And that provides, I think, the highest level of multidisciplinary care for our patients.
So patients should know that they have not just each of you, but at least two other people on that team too, looking for the best treatment option.
And if I could add to what Dr. Zevallos had mentioned, given the location of head and neck cancer, it oftentimes impacts lots of our daily function, speech, swallow, hearing. And so in addition to seeing three physicians, we also are able to allow our patients to see swallow therapists, speech therapists, audiologists to help not only cure the cancer, but maintain as high functioning as possible after treatment.
Certainly quality of life is an important
Absolutely.
Consideration too. I kind of want to talk, Dr. Rich, a little bit about the symptoms of head and neck cancer.
Sure.
I mean, oftentimes when something's wrong with us, we have a sense that isn't quite right. But what are some things that people should be concerned about if they notice them?
Sure. I'm going to start by clarifying that a lot of the symptoms are also very vague, that we all suffer.
Okay.
And so I'd like to say that the things that we'll talk about, usually if they're persisting for more than about 2 weeks, that's when we should get worried. But there's symptoms such as trouble eating, feeling like there's trouble swallowing, feeling that there's something stuck in the throat. Also, voice changes. Sometimes patients will feel a mass or a lump in the neck, and that's always concerning for an adult. If there's any lumps in the neck, that's something that should not wait, but go straight to a physician. And also, of course, for skin cancer, any lesions on the skin that aren't going away, that are getting larger.
Okay, so if someone does have these persistent symptoms, what is the first thing they should do?
Well, I think there's a number of options. One is, of course, to go straight to their primary care physician. But if these are persisting, they need to be referred directly to an otolaryngologist or a head and neck surgeon like ourselves,
Okay.
or in our department.
Very good. Thank you for that. We do have another question from a viewer here. Mary Ann asks, what about squamous cell on the neck?
So squamous cell on the neck, it's a good question. It refers to probably two different things.
Could you tell us what squamous cell is?
Sure.
Yeah.
So the squamous cells are the types of cells that normally line our throat and actually our skin. A squamous cell carcinoma is a cancer arising from those cells. But those cells are normally both present in the lining of our throat and on our skin. So when someone says squamous cell of the neck, it may refer to a squamous cell arising from the skin of the neck, or it may refer to a cancer that's spread to a lymph node in the neck from somewhere in the throat.
Okay.
So commonly, patients come in with a neck mass. They have a needle biopsy and it shows squamous cells. Squamous cells aren't supposed to be in lymph nodes in the neck, and it likely means that the cancer has spread from somewhere in the throat to a lymph node in the neck, and then our job is to find out where it started.
Okay, very good. That's helpful. I guess we sort of touched upon treatment options a little bit. Are there other information that you have to share on how people are treated, clinical trials that are available or such?
Sure. For head and neck cancer, there's really three types of treatment that patients receive, and it could be one, two, or all three in different orders. And that's the complexity of head and neck cancer, but it really comes down to surgery, radiation therapy, and chemotherapy. And as Dr. Zevallos mentioned, there's a lot of nuances, and so that's why we discuss as a team what's the best treatment, timing-wise, types of treatment. But those are the three main treatments that we use.
And I know surgery is your specialties, but could you describe a little bit what radiation therapy is and chemotherapy is in treating head and neck cancers?
Sure. So radiation is using radiation beams to treat and focus cancer. So oftentimes it's given. It can eradicate cancers in the head and neck. It could also be used after surgery to make sure that any residual or microscopic disease is taken away. Chemotherapy given by a medical oncologist is different types of agents that are either given orally or through an IV that also are intended to kill cancer cells.
What people consider drugs, I guess?
Right. Different chemotherapy drugs. That's right. Now it's important that both actually surgery, radiation, and chemotherapy all have side effects. They all have different levels of side effects. So our job is to figure out how to give the best treatment, using these combinations, to give the best treatments that will eliminate the cancer and hopefully limit side effects for our patients.
All the more reason to go to a place where there are specialists who work together to determine the right combination.
I think if anything, of all the things that we can talk about, the most important thing for our patients is that they seek true multidisciplinary care.
Very good. Well, I think that's a good point to finish on. We have run out of questions from our viewers, so thank you again, gentlemen, for being here today.
You're welcome. Thank you.
And we want to thank you for joining us for this discussion of head and neck cancer and treatment. Please follow Siteman's Facebook page to learn about future Facebook Live events. And as always, we appreciate you being here. Thank you very much.